I wanted to talk a little bit about an idea I had that I thought was really interesting. So essentially, people want to pay for luxury items, right? People want to pay for cars. They want to pay for good food. They want to pay for clothing that's nice and gives them a comparative advantage. People want to pay for advantage. They don't want to pay for healthcare. They don't want to pay to do things to live, basically. Healthcare basically says, okay, so you're going to pay this fee and you're going to get access to stuff that helps you live. And many people say, well, that should be free. Okay. We're not going to talk about that right now. We're going to talk about how if we just assume that healthcare should be equally distributed to everyone, okay, or you should have to pay for it, right? Where does therapy fit into that? And here's why I asked that. So if anyone breaks a bone, then the prognosis for that is the bone's broken. It's not going to heal right if you don't get it fixed. The prescription is set the bone and heal it. So that's what anybody would get through health insurance, right? It's a level playing field. Now, here's what's interesting. What is psychotherapy and where does that fit in? So think about it. So as far as I'm aware, most doctors are going to set a bone and they're going to heal it the same way, right? Most medical doctors. So insurance pays for your medical care in a certain way that's a level playing field. So we're talking about, is therapy, healthcare something else? Because healthcare says you receive a service for a fee that you pay. Either you're on government assistance or you're paying. And most people don't want to do that. They want to be able to use their money for luxury goods, not to stay alive. But we can get into ethics, all that another time. But therapy is more complicated even than that. So the broken bone metaphor is one I use often, because if you break a bone, you go to doctors, they're going to do an x-ray, they're going to set the bone. Big deal. Very uniform. Now, here's where it gets interesting. If you are depressed and you go to different therapists, one of them may want to do inner child work. One may want to do trauma healing, which through EMDR or something else. One may want to do an exercise chart with you and have you do behavioral activation therapy, where you do new things regardless of how you feel about it, and then chart your mood, right? So think about that. I've just named at least 3 different approaches to the same condition, right? Nobody's doing broken bone alternative therapy where you meditate and heal how to cast, and having healthcare pay for it. Keep that in mind. So healthcare pays often. Aetna, Blue Cross Blue Shield, Cigna, United, major health companies, and Medicaid and Medicare pay for psychotherapy. Now, therapists have to put down the approach they're using, theoretically. But what they do in office, since there's no prescription, there's no trail of it, like there is in a doctor prescribing meds and pain meds, etc., you don't really know. And one person could get the worst therapy on earth where they're basically told, oh, that sounds really bad. Have you tried walking? Oh, okay. Well, what about just accepting yourself? Somebody could get basically the kind of conversation they get from a high school friend over coffee, and insurance pays for that. The same amount of doing intense trauma work with someone else, right? Like another therapist gives intense trauma work and reprocessing, and that ends up being paid the same copay and the same reimbursement. And that person gets a tremendous advantage for processing their trauma and being done with it. And the other person is left with horrible assistance. And another therapist could be a wellspring of knowledge about how to think properly, how to address body sensations that are intrusive, like EMDR helps to do that through reprocessing the memories attached. And that's an advantage. That's big. That is a service. So there is an uneven playing field now in the therapy world as paid for by insurance. Some people are getting bad therapy. I know because they end up in my office and they tell me about what was done to them or not done for them. We'll take it with a grain of salt. But I also believe my clients. And I also can believe that there's amazing therapists out there. And there are some that maybe don't know what they're doing. That's okay. So we just have to be honest about that. It doesn't mean that therapists are bad. I think most therapists, I think 90% of them at least, more than that probably, really want to do well by their clients and aren't in it for the money. It doesn't pay that well, which you could argue as an incentive to have people who are ambitious not go into the field. That's a whole nother deal. But I just wanted to get this out in a format like Substack where this saves and I can take clips of it, because I think this idea to really help nail the thesis home, psychotherapy as it stands now, paid for by insurance, can either give you a massive advantage or nothing. And it's unfair to the consumer. It would be the same now as if someone went to a doctor who didn't get them an x-ray for a broken arm, or they went to a doctor who gave them an x-ray and gave them advanced bone healing serum. That's the discrepancy in the level of therapeutic care that patients are getting with their health insurance. And I don't think most people know that until they have spoken to a therapist who is well-trained and knows what to do after dealing with one who didn't really help them. Psychotherapy is notoriously difficult to quantify, probably because it's equal parts spiritual, mental, and physical care in certain ways. It's definitely mental and personality care. It's a lot combined. It takes the place of essentially the religious world for many people. So it's not like, it's definitely behavioral health, which is subsumed now under health care, under bodily health care, but it's certainly more than that. And if you are engaging in philosophical conversations and getting a lot of information download from a therapist who's very wise, then you're getting better treatment than someone else who pays the exact same premiums. Or you're on the other side and you're not getting good premium. You're paying insurance premiums and you're getting bad therapy, and someone else is getting better therapy because they knew what to look for. So I think an upcoming video needs to be about what to look for when you're looking for psychotherapy. You need to look for evidence-based practices, like someone trained in eye movement desensitization or reprocessing. You need to look for various different training, not just a 2-year degree and I work with everything. That person's desperate for clients. I'm sorry. A therapist who will take everyone specializes in no one. I will not do couples work. I do intensive trauma and PTSD work for people with intense flashbacks. I'm not going to do couples therapy. My caseload needs to be for my specialty. I know plenty of people who love working with couples, kids, and addictions. I work with behavioral addictions, shopaholicism, love addiction, all kinds of things. I've done substance abuse work. But if you're a therapist, if you're going to get therapy, look for postgraduate specialties on that person's resume or their Psychology Today page. Look for that stuff because it shows they care and they want to specialize and they want to do something. A therapist generalist is not the same thing as a family doctor. It's just not. Right? I don't think most people know that. But essentially, let's see, systematic change is on the rise. Yeah, I think so, systemic change. I mean, so think about it. Like someone could be getting the best therapy on earth and paying insurance, and someone else could be paying private pay and they don't know any better. They're going to someone who just says stuff that the person wants to hear that sounds nice. It's basically organized, glorified marketing. Like you don't know. And so you have to know what you don't know. And a key ticket here, some people aren't going to like this. I'm going to just call it out. The phrase evidence-based practice really matters. What else are you going to benchmark the therapy on, right? That it feels good to hear your own thoughts. Like, no, you need to see evidence of change. It's evidence in evidence-based practice is healing. So it's not like it's being done apart from your benefit. So I think we need to really, as therapists, circle the wagons on the discrepancies, the disparities in treatment that clients are getting, because it's there. And some people are getting basically their health insurance to cover Socratic philosophical masterclasses every week for an hour. And other people are getting someone who all they know to do is be nice and say, that sounds rough. And that's not fair. And it really, if most Americans knew that, there'd be a massive upheaval in my profession, which may very well be necessary. So on that note, I'm going to end this. I'm going to see what clips come out of it. I'm going to take this and put it into Riverside and edit it and do some show notes because this has been really important to me. And I think it should be important to most Americans that their health insurance pays for their treatment in a way that's the best they can get and where they get a good recommendation. So I would end it also with, I think it's a little interesting. People believe therapy should be free because how's the therapist going to get paid? And should it be free to get a massive advantage in how you think? Throughout history, if you want to think better, you study and become a philosopher yourself. You don't go to a therapist and immediately have it downloaded to you where you have basically a cognitive advantage for the price of your insurance premiums and copay. So I think we have a broader philosophical conversation to have that I don't hear a lot of discussion about, but I'll end it there and that'll be its own podcast. Thank you so much for tuning in and I hope to talk about this soon.